Thank you, Dr. Birch. I'm an epidemiologist from University of South Carolina, and today is my great pleasure to be able to be invited and give a talk on the topics which is really close to my heart, and I've spent several years to work on this topic. So my talk today is basically I want to debrief you about how maternal weight gain during pregnancy can be important and novel new preventive factors to in a consideration for the design of the policy and the programs in prevent childhood obesity. There's no doubt obesity epidemic is a severe public health crisis in the United States, and in the past 3 decades, the prevalence of the obesity has been increased among adults and then children as well. And we know that the obesity is notoriously hard to treat, and also it has a severe health consequences for late in life. So because of that, we're really worried about our supersized kids who are the future of a nation. Many of you probably have heard about the fetal origin hypothesis. Basically, it was first proposed by researchers in early 1980s, or someone claims it's even early in the 1980s, by Dr. David Barker. And what it says is the influences occur during the sensitive period of time, such as prenatal periods, can have a long time impact on health. And then before birth, the development of organs and also the systems is profuse in plastic. So therefore, the fetus is actually susceptible to the perturbations in that period. And numerous animal experiments and human studies has already provided evidence to support this hypothesis. So my talk today is actually focused on maternal weight and then gestational weight gain and also early life factors, how it's actually have a role on the early obesity development among offsprings. And at the end, I'm also summarize what is the potential implications for public health programs and policies. So this chart summarizes the age-specific mortality rates among very young infants. And then, most of them are under 6 years old. And data come from the large HMO from Massachusetts. And what we see, for the bottom line, which is the 0 to 6, months old babies, and then top one, 12 to 24 years months of the babies, we see this rising trends of the obesity from 1980 to 2001. So all this data come from where child visits. And what this rising trend indicates there's early life influences. Especially those influences may occur in the pregnancy in early time. We know that there was a bunch of studies have shown that a maternal pre-pregnancy weight is associated with multiple indicators of the offspring's weight, which is usually measured as the intrauterine fetal growth, or the high birth weight, or the offspring increased risk of the obesity. And the first explanation we may have is, there's genetic factors, the shared gene of the mother and then children, which contribute to the similarities in weight for the mother and then the offspring. Of course, we know, extrauterine environment, such as the shared behavior and environments, which would play important, factors on these similarities between the mothers and offspring. And what I want to argue today here is, in addition to the mother's pre-pregnancy weight, what happened, excessive nutrition during pregnancy also have independent effects on the childhood obesity. And then we know excessive weight gain during pregnancy is actually indicator of excessive nutrition, overnutrition during pregnancy. And this gestational weight gain can serve as a potential mediators and moderators, of the associations between pre-pregnancy weight and the offspring obesity. So what is gestational weight gain? It is the weight at delivery minus the pre-pregnancy weight. And it's usually measured as the total weight gain throughout the whole pregnancy, or the weekly rate of weight gain. Sometimes people also use the median ION guideline. So Institute of Medicine in 1990 published the gestational weight gain guidelines. And this guideline was further updated slightly in 2009. So as you can see here, for women who have 40 weeks, 40 weeks of pregnancy, the total weight gain, recommended total weight gain for underweight and normal weight women are more than those for the overweight obese women. Because overweight obese women actually already have extra storage of the energy in the body. And so how much weight women are gaining during pregnancies? Here's the data from the for US data. We know that 46% of women are exceeding this ION recommendations, which is a lot. And 23% of them are gaining inadequate weight, that's less than recommended, which is also a concern. And then only 31% of women are gaining within recommendations. Given this is a local, regional conferences, I also want to share you data from South Carolina. We look at the birth certificates data from South Carolina 2004 and 2006. We notice the median ION guideline vary by race ethnicity. And then non-Hispanic white women, actually to our surprise, is a little bit higher in terms of gaining excessive weight than the Black and then also the Hispanic women. And the Black, of course, is 45% is pretty high as well. And when we look at it by pre-pregnancy BMI, we notice the gaining excessive weight is even higher among overweight women and obese women. And for overweight obese women, they also have especially obese women, the last one on your right. Actually, they also, have a high risk of gaining inadequate weight, 35% of them. And then the gaining within the guideline is low, 15% for obese women, and a little bit, of 17% and 28% for the normal weight women. So this, this stats is not good at all. Several of us at the University of South Carolina are very interested in this topic. So the past 3 years, 2 or 3 years, we actually conducted a systematic review on the association between the gestation weight gain and then offspring adiposity. So the paper is in press right now. What we did, we searched the 4 databases and including only focus on the cohort study. And then at the end, we find 23 articles meet our inclusion criteria. And we include all the articles from inception to the March 2013. And then we only focus on kids 2 to 18.9 years old. And the paper was led by Eric Law. She's in the audience. So what we find is the 1 kilogram increase in total weight gain is associated with the increased child BMI Z-scores, and also the high risk of having overweight, obesity, ranging from 1% to 23%. And then when we're looking at the gaining excessive weight according to IOM guideline, we also find consistent results. And there was one study actually looking at the timing of childhood obesity. So what I find is actually gestation weight gain more likely to have impact on early onsets, which is 2 to 6 years old, of childhood obesity, rather than late, after school years. And so the results here, of course, we, based on 23 studies, and there was another 2 reviews also published earlier than ours. They included fewer studies. All these studies, systematic review consistently find the gestation weight gain has independent effects on childhood obesity. So the question is this really, shared gene or lifestyle factors between mothers, or it's really inter-uterine environments? So there's a couple papers actually trying to tease out relationship between these 2. And then Brennan published a paper in 2011, and then using the data is pretty old. It's a collaborative perinatal projects in 1960s, and in United States. And what they find is there was a significant associations when you just do traditional longitudinal data analysis. But however, if you consider the sibling effects, and they find there's no associations. So of course, keep in mind that's the data from 1960s. And Dr. Debbie Lola from the University of Bristol, and using the data from Sweden, and of course only focus on men because the data come from the military recruitment. And then their cohorts come from the 1980s. And what they find is they also did analysis of a longitudinal analysis and also sibling within sibling. And what they find, the relationship is actually modified by the pre-pregnancy BMI. So among normal weight women, the association is more related with the shared familial characteristics. That means it's more shared gene, more shared lifestyle factors plays a role. However, among overweight obese women, there's a greater contribution for in utero environments contribute to this childhood obesity. So what are the mechanisms can lead to this, intrauterine environments have a impact on the childhood obesity? Dr. Macmillan wrote a paper in 2006, and then basically the overall arching ideas is the maternal overnutrition or mother who have a high BMI. He did not distinguish these two. Which means the excessive exposure of the high glucose and high insulin in fetal stage, and which can increase the leptin synthesis and secretion in the fetal adiposity tissues. And those things also will have impact on central neurons in energy balance regulating systems. All those factors will have impact on the fetal growth and then childhood obesity. So another way they're looking at is looking at how this maternal nutrition also would have impact on altered appetite regulations and altered adipocyte metabolisms, which will lead to childhood obesity. So what can we do with the maternal weight, excessive weight, and also excessive weight gain during pregnancies? So one thing we potentially can do is actually before pregnancies, should we recommend all the women to gain maintain a healthy weight before they enter pregnancies? So obviously this sounds very unrealistic for multiple reasons. Number one, we know over half of the women who are overweight obese, for childbearing age in the United States, which is impossible. We're asking them you have to wait. And then half of the pregnancies, in fact, are unwanted or mistimed. People are not planning, what time they really, get pregnant. And then we all know it's really hard to lose weight. So another hard part of here is there was a biological clock. It's clicking. And if you wait too long, you not ready for, prepare for your pregnancy, then your fertility actually reduced. So the message is good, but we think it's still not realistic. So then what we should do, during pregnancies? And that's why I think that's the beauty of looking at gestational weight gain, because it's modified risk factors, and we can do something during pregnancies. If we can help women to gain adequate weight during pregnancies, we can still reduce the offspring's risk of having obesity later in life. And another opportunity here is pregnancy is basically a good time. Women are very receptive to health messages for themselves and also for babies. They're willing to modify behaviors, and then it's a captive audience because they see the OBGYNs frequently. So the intervention can be very simple by informing the pregnant women what is the recommended weight gain for them. We notice that many women actually have no idea what is recommended weight gain. And also at each prenatal care visits, or even after prenatal visits, we can just use in that chart to actually mark down what is weight you gain at this stage, and then can alert women if you are close to the borderline of the range. However, to have a sustained effects on the weight gain, I think we should modify behaviors during pregnancies. So this area in the past 5 or 10 years actually is a very hot area. Many people have designed lifestyle interventions for this specific populations. However, based on the review, we conclude the effectiveness of those programs are very modest. And those like weight management programs are primarily focused on the white women or normal weight women. And very few of them has been targeting the overweight, obese, ethnic diverse women, and financial disadvantaged women. And those are the actual high-risk women. So to address those gaps in literatures, I have teamed up with a very experienced health psychologist, Dr. Sarah Wilcox. She's in the audience today. So we have designed and also pilot tested a lifestyle intervention program for overweight, obese African American women in South Carolina. And then we're very luckily, know that starting from August, we actually received the funding to continue to test this promising program, in a randomized trial fashion, and also among, large cohort of women. So in our new program, we added white women because we noticed white women also have a high risk of having, excessive weight gain. So our goal is to recruit 500 overweight, obese women, and half African American women, half of the white women. And all the women will be enrolled in very early during pregnancies and followed until 12 months after delivery. And the primary outcome of interest is gestation weight gain. We want to help women to gain healthy weight during pregnancies. And then our secondary outcome of interest are the postpartum weight retention for the mother. Today, with the time issue, I did not discuss too much about how it's important for weight retention, obesity prevention for women too. And the health behaviors and child adiposity at 12 months postpartum. We hypothesized women in our intervention group, their offspring would have a better health adiposity indicators at 12 months postpartum. The study will be, was funded by NIH. So stay tuned for what we find in the next 5 years. I know the other speakers here is going to talk about what we can do for after delivery. I just briefly address a few things here. I think after delivery, the infants should be fed with breast milk and then also be exclusively breastfed for 6 months. And then it's very important to pay attention to see how we introduce the solid food to the infants, what timing and what type of food. And it's really important to help our new generation to establish a healthy lifestyle starts from beginning. For mothers, if you are normal weight, you should consider to return your pre-pregnancy weight. If you keep those excess weight on your body, you probably will have high risk, change your BMI, high risk of being obese in the life. And for overweight obese women, it's very important to lose weight postpartum because we mentioned about how maternal weight have impact on on offspring weight. So you reduce the weight at this time will have a healthy weight for next pregnancy. So in brief, I conclude, achieving healthy weight gain during pregnancy hold promise to prevent obesity in the offspring. Healthy mom, healthy child. And I do want to acknowledge my collaborators, Dr. Sarah Wilcox, and co-investigators on the new study funded, Dr. Bree Turner-McReeve, she's in the audience too. And then over the years, I have received so many support and collaborators who work with me on this topic. And I really appreciate a bunch of graduate students who express interest in this area, have been working with me on various topics related with the pregnancy and the early childhood. And finally, I want to acknowledge the mentors who has helped me over the years. Thank you. parity, yeah. What happened is the women who are later in pregnancy, who are higher parity, the more likely to gain excessive weight. And the first parity, of course, noniparous women have a high tendency of gaining excessive weight too. Yeah.
Other questions?
Yeah, there's one in this.
That was very interesting. I'm excited to be here and hear about this. I know you didn't get to go into detail about how your approach was going to be different depending on the background of the race of the mom. Can you talk a little bit about how that might be different?
You mean in the literature or in the new study?
Yeah, in the new study.
We don't have a separate different program for different race. We will have the same program for both white women and black women, and we want to see whether they respond in our program differently. Yeah, so we do plan to check the racial differences. The program evaluation? Yes. So her question is, do we have an exit interview and how you evaluate women's opinion about your intervention? Yes, we do. So our study will have a 4 measurements time, baseline, and then 32 weeks during pregnancy and 6 months and 12 months postpartum. So I think 32 weeks, which is close to the end of our pregnancy interventions. So we do have evaluation forms. And the postpartum, 12 months postpartum, which is at the ending points of the postpartum components, we're going to do evaluation too. Yeah. Thank you.